Hey, good morning. Steve Stites, Chief Medical Officer here at the University of Kansas Health System, back with you live from broadcasting from the Dolph Simons Family Studio. On my right is Doc Hawk. Always a pleasure to be back with him. Tara Marchello, who's one of our outstanding dietitians here, is here to talk to us about those things that will keep us healthy and happy during COVID. Yesterday, Tara, I'll come back to you in just a moment, but I'm going to set you up right now. Potato chips and fried chicken. The answer is going to be, you don't have to answer it yet. I want you to think hard about it.
All right.
Comfort foods, there you go. In the meantime, Hawk, how are we doing?
I say yes to those.
I say yes to those too.
In abundance.
And I did not before COVID, just to be clear.
That's part of cows, right?
It's part of cows. It's part of how you address cows.
Yeah, the numbers aren't as good, and I think we have to explain that we are really expecting to see different, not waves of new cases, but the numbers are going to change.
They
from
go up
day
and down
to
all the
day.
time.
And so it's hard to say this is a first wave, this is a second wave. I think this is right now the new normal, where they will go up and down, whether it's new cases in Johnson County or in the Kansas City community, but also in the hospital. So today we do have more than yesterday. We have 29 patients in the hospital, which I think we had 23 yesterday
23,
or 25.
maybe 21 at one point yesterday.
10 of those are in the ICU, 5 of those are on the vents. We should say that 3 of the patients, 3 other patients on the ventilators do meet discontinuation criteria, so they are in the convalescent stage. The main point of that is...
You're not saying withdrawal care. You're saying they're no longer considered acute COVID patients.
Correct.
But they're really hospitalized and on the ventilators
Yeah.
because of the things that happened to them from COVID.
Right, and the main point is they still remain on the ventilator, so that means they have been here a long time on the ventilator and are still on the ventilator. So we do have 30 other patients in the hospital that are not counted as acute COVID patients, but are still having to be here for one reason or another.
From COVID.
From COVID.
Yeah. And that, again, that distinction is really a reporting distinction that we're asked to do. We report the acute cases here every day, and the reason we've done the acute cases is that's what the government's asked us to do for their distribution of things like convalescent plasma or remdesivir or another PPE. So I think probably more than convalescent plasma. But then, the thing that we've reported to the public all along is the acute numbers, because that gives you a sense of what the actual activity is, the new activity out in the community. So we've always said that number and continue to do that, but we're going to try and do both so people know exactly where we are, because that says really that if we do 29 and 30, that's almost 60 patients who are hospitalized right now due to COVID of some sort.
Yeah.
And that's a big number.
Well, and even Dr. Weil had a good interview yesterday. Basically, he said, we have essentially then 50 to 60 patients in the hospital who wouldn't otherwise have to be in the hospital.
Right, exactly. That's
And
what
so
we said the other day on the program. It's taking up 60 beds in the hospital, which is limiting some of the abilities of the hospital to do other things. But 30 of those, or 29 of those, would be in that acute phase when there still could be infectious to others, and the others are not. They're still in recovery or convalescent phase, and we hope they continue to recover and do well. Tara.
Yes.
Okay. Talk to us about chips and chicken, especially fried chicken.
Well, I think they might have a little place. Maybe we'll talk about it.
Brookside Poultry, have you been there?
I have not.
Oh my gosh, it is so good.
Brookside Poultry.
Okay, no, it's kind of a nice fried chicken place over on my neck of the woods, and it's the best. So.
Well, I think that's the good news, right? Yes, it's important to kind of look at the focus of our diet and the choices we make, but there's a little room in there, a little wiggle room for those fun foods and indulgences,
Yeah, okay.
I think it's really important for people to understand, for sure, that they can have their place. They maybe just don't need to be the focus, right? So, definitely understanding a general healthy diet is going to be the key focus in everything we talk about today: immune health, stress, sleep. When we think of general healthy foods, we think of nutrient-dense foods, so foods that have a higher nutritional value, so a little more benefit to offer our health. Whereas maybe the chips and fried chicken are what we call calorie-dense foods and have a lower nutritional value, so maybe don't have quite the same benefits, at least in some regards, right? Might have some emotional happiness benefits.
Mental and emotional.
Mental and emotional,
exactly.
That's right.
Hey, which all that ties in, right, to overall health. But I think the key, goal is that we need to understand where that focus lies. What's taking the most weight in our diet? Is it those higher nutritional value foods, or is it the chips and fried chicken type foods? And definitely helps sort of free our minds if we can accept that we can have the balance. Maybe not so easy to find all the time, but it can happen. So I guess we'll dive right in, right? Let's talk immune system a little more specifically. Actually, I'll back up and just kind of tell you what I mean by general healthy diet. General healthy foods. It's the same across the board for everything we talk about. Again, it's going to be fruits, vegetables, grains, mostly whole grains. That really just means grains with a little more fiber in them, in a nutshell. Lean meats, healthy fats, fatty fish like salmon, tuna, fermented foods even, low-fat dairy. So the list goes on and on. Plenty of options. When we look at the immune system, it is just that. It's a system. So it is a collective effort, not just nutrition alone. But
Sauerkraut's good for you?
Huh?
Sauerkraut's listed as good for you?
Sauerkraut, yeah.
Oh, I don't do
Fermented
sauerkraut.
foods, yeah. Mm-hmm.
Okay.
Right?
I like avocado, salmon, burger, some of these things.
Unless you have a stomach issue, then you might want to consult your doctor. So this is
Okay.
good general healthy advice, but please note, this may not be appropriate for everybody, so.
Where are potato chips on that list?
Now this is the nutritional, high
This is
nutritional
the good
value
stuff.
section.
Got it. Okay. Okay, fine.
But very good that we're noting that everything has a place, of course.
So last night I had trout and a salad, and trying to think of what else my wife cooked for dinner. It was pretty good, actually. I have to give credit to that. So that was a healthy dinner then. The
It
trout.
was.
And blueberries, grapes, cherries.
Absolutely.
Those are good.
All of them.
Okay,
People
see,
often.
I'm not a total.
Yeah.
I'm not a total.
I had halibut, yeah.
Yeah, that's good.
Halibut, wonderful. Trout, great, yeah.
okay,
Very
good.
good.
Did you catch that trout?
I did not catch that one. Well, my wife caught it someplace, probably over at Price Chopper, I think.
Definitely good choices. Yeah, so I mean, our gut health is definitely going to play a role in our immune system. So as far as nutrition is concerned and immune system, what we can, obviously digestion and absorption of nutrients. So the first picture we had up with the plate is really showing us that balance too. This is going to ensure that all the varieties of foods that we eat are giving us all those vitamins and minerals and antioxidants that are important and helping our health. So definitely the first key is that balance. Good takeaway for you there. Come see me if you need more info. Little plug for myself there. And then just kind of looking further, the gut health. So we need the high fiber foods, fermented foods, healthy fats. Those are your three kind of big categories there, as they all work to reduce inflammation and therefore help gut health. So that's kind of immune. So to tie that in with stress, same factors apply, because we are learning that gut health is connected to brain health. So we've always known that healthy fats like omega-3s, salmon, tuna, trout, halibut, walnuts and such have those brain health benefits, but now we're understanding more about gut health connection to the brain. So same takeaway applies here. Get those fruits, veggies, high fiber as a whole, and reduce those lower nutritional value foods. Again, having a place, I can't say it enough, I really want people to have a realistic diet pattern in their life and enjoy all foods. I love food. Right? You love food, right?
No, I
and
love
so many
food.
people take it so black and white. But, if our diet is focused in the lower nutritional foods and we're eating nothing but those calorie dense, emptier calories, then we're not ensuring we're getting those full nutrients and that help us stay healthier and benefit us.
So what you're really telling us is we should be healthier in order to fend off the evil coronavirus.
Well, I can't say it will do it for sure. I mean, it definitely helps, right?
Every bit helps,
builds,
right?
if we
Ooh,
build
wait a minute, I saw grapes on that next slide. Go back to the next slide, because I
Well,
like
these-
grapes.
So grapes, all fruits and vegetables. Foods that, look at me looking at the camera here.
Yeah.
Foods that benefit sleep. So these foods really are kind of the ones that are known to maybe have a higher value of like sleep-inducing hormones, serotonin, melatonin, tryptophan. Now, there's a key to sleep, though, because we got to be careful of how close we eat to bedtime, too. But yes, those are sort of the higher, some of the key foods that have those higher nutrients.
Okay.
Chamomile passion fruit tea really is more of an antioxidant that creates a calming effect. Tart cherries have melatonin and tryptophan, so a little more benefit of getting more
Lots
of
of
those.
good ways there, yeah.
Yeah. Oh, yeah,
So
grapes are there.
Yeah, I saw cherries and grapes. I'm like,
Yeah,
I'm in the
well,
money here. This is good.
Wait on it. Yeah. Honestly, an overall balanced, healthy diet will
Help you.
promote good sleep
Yeah.
overall.
Where did Cheerios land?
Well, believe it or not, I mean, Cheerios can have some added benefits. because of the fortification and helping kind of with those sleep hormones too. So
Okay, well, see, there you go.
one of the key things is, though, we got to be careful with digestion, having heavy meals before we go to sleep, because we are, digestion slows up to 50% while we sleep. So we don't want to go to bed on a full stomach. We don't want to have high fat, high protein that's taking a little more work to break down.
Okay.
So kind of, complex carbs that kind of will be a little more beneficial. Avoiding foods that cause heartburns. This is a big one, and it's very generalized here for y'all, but again, I can help you through that. But spicy foods, acidic, coffee, caffeine, peppermint, chocolate even, sadly. Caffeine's the big one there. So caffeine can stay in the body up to 7 hours, so really being careful of that as well. So just, ideally we would avoid the large meals. We'd eat a little more balanced through the day. Have our last meal maybe 2 to 3 hours before bed. If we really need something closer to bed, maybe just a little handful of nuts. Or as I mentioned here, the unsweetened tart cherry juice concentrate. Now, if this is a little too sour, add a little water with that. But, just kind of keeping your overall health in mind with sugar and juice and all that good stuff, or a little tea. So some of the diets you can research are the Mediterranean diet and the DASH diet. These are very well, researched, and studies have proven the benefits of these diets, definitely with that focus of all those beautiful foods. And what's nice is it still tells you, hey, sweets, indulgences, fried chicken need to be on the minimal side, but we definitely can have a little bit of everything.
All right, that sounds pretty good. And it sounds like, Dana, that what she's really saying is if we eat healthy, we'll be a little bit healthier, which I think we would probably like.
Yeah, and I think it's all about the whole lifestyle. It's
really
just
is.
like coronavirus and protection. It's not one thing. It's a combination. I think that goes to eating and overall health. It's the calorie input and the calories you get rid of by exercise. I think it's part of the whole lifestyle,
It
just
really
like you're
is.
talking
Yeah, good
Absolutely.
stuff. All right, well, thank you.
Yeah, you're welcome.
I think most of the things I believe in are on that list. That's a good thing. I don't know about whether I believe in it or not. It makes any difference, but
That's just the nutshell of the list, right?
yeah, no, nutshell, no pun.
right.
No, nuts are good for you, right?
They
Isn't
are,
that the
they
deal?
are.
Almonds are supposed to be good for you. Where do plantains fall on that list?
They're a fruit. Well, they're fruit, yeah. I had to think
Yeah.
about that one
How
first.
about
Not
fried
as common.
plantains? What about fried plantains?
Well, the fried factor starts to kind of decrease that nutritional value. Maybe we can compromise and say it fits somewhere in the middle of the...
Okay, sometimes good, sometimes bad. Just don't have too much of it.
Yeah, the fried foods
Okay.
definitely, right. They can get
right.
you. Even if you're frying healthy foods, it's still fried.
All right, shout out to Dr. Lolo Ojo out there, who makes the best fried plantains I've ever had. Okay. Jill, I bet there are some questions out there. Let's see if the media have any questions for us this morning. None, all right.
All right, we got a lot of questions, and they're kind of all over the board. Guy wants to know, how do you feel about replacing milk with soy or almond milk?
Okay, Tara, that's definitely you. This is not Dana. No.
Good
Go ahead.
question. So a lot of people are using more alternative milks today. Definitely, if you have a lactose intolerance or a dairy intolerance, we need to turn to those other options. Whey, which is a component of regular cow's milk, is a wonderful source of protein. I think either one for you. Milk and dairy can come down to the dose. How much are we having in the day is really important too. But yes, soy milk, so the most comparable in nutritional value to cow's milk. So I'm talking, that full picture of protein, especially because a lot of alternative milks do lack the protein content, and we want to make sure you're keeping your protein in. All of them are fortified. Protein would be the only thing sort of missing in some of those, but any choice that works for you. Pea protein's becoming very popular, hemp milk, and those two also have a really nice protein content.
All right.
Great.
All right, Elena says, my child is incredibly picky eater.
Kinda
I
have
know
one of those.
vitamins aren't required by the FDA, but do you know of a good multivitamin for kids? How do I get vitamins in that kit?
Yeah, my daughter only ate beans and weenies. I don't know if she's out there listening right now, but Leah, my oldest, for like their entire life ate beans and weenies, and now I think she eats only legumes, which is probably good. She eats that's pretty good.
That's good,
Try to get her to
yeah.
diversify the diet a little bit, but beans and weenies was her diet when she was young.
Well, that's, protein and complex carbs.
Yeah, I guess
Nice
so.
balance.
Right out of a can.
The kid issue, that can be a challenge. I think as far as multivitamin, there's so many out there. I would suggest just chatting with your doctor about the ones that's most appropriate for your child. Obviously, I think the big takeaway is, from my standpoint, is if we can't meet all of these ideal goals, then a multivitamin definitely has its place. And then maybe from there ensuring, with the adult, I'm kind of broadening your question, but, checking for any deficiencies that we may need to supplement as well. But as far as kids, I think we have to lead by example a little bit. Get them involved maybe in cooking. Use cookie cutters to cut fruit or vegetables. Teach them. They get so... they're so proud when they learn something, and then they can kind of show you too. So I think working together as a family can be fun. Heck, even turn on the radio and just make it a party. Make it enjoyable, and repetition is really key. Research supports if we keep showing that kind of putting that same food in front of the child over time. Roughly in 2 weeks' time, they start to kind of accept it. You never want to force feed your kid, though, right? But patience is definitely a key there. But I hope that answers your question.
Yeah, that's probably better than what I did. I would hide it.
Yeah, my mom
Sneak it
tried
in,
that.
yes.
My mom tried to do that with asparagus buried inside applesauce, and I was like, "Wow, what happened to my applesauce?"
Yeah, you got to be more sneaky than that.
Well, and I think that brings up a good point. And I have to do that with adults. Where can we sneak things in? Cauliflower is good for that because it's white. You just cream it up and
There you go.
sneak it in macaroni.
So Lindsay and Barbara are both asking if you would weigh in on our air fryers versus fryer fryers. Our air fryers.
Yeah, good question because it's super popular right now. So air fryers are kind of working like a conventional oven. It's really basically kind of roasting, but it's maybe a little more sealed, so you get kind of a quicker result
Crunch,
in a faster time. But typical fryers, you're submerging that food into fat. So even healthy fats.
You're going to like the air fryers, aren't you?
I think I will.
Yeah.
Okay. I have a friend who's like, that's just so ridiculous. I'm like, yeah, they have their place, I love them.
Yeah.
We all have that desire for the fried chicken. So maybe we could do the faux fried chicken sometimes to kind of balance out the fried chicken intake, and, prepare it the same and stick it in the air fryer. Will help you get that result without submerging it in all that fat.
Okay. I'm going to try that with with chicken and French fries. We'll see how it goes.
I mean, healthy fats are good for us, but we still have to be careful on the dose, right?
You bet.
But yeah, try it.
Pat wants to know what you recommend for people who've been diagnosed with COVID, and what should they be eating to try to make their body strong and get over it?
Yeah, well, I think, as you're closer to having COVID, you may not feel so great. So I think the big takeaway would be work on your calories. Let's get, make sure we're fueling your body so that your body has that gas in the car, so to speak. So calories. When we can kind of evolve the diet and begin to return back to normal appetite, definitely we want to get protein in. If you've been bedbound especially, protein. We need that for muscle mass, tissue repair. I'm not talking you have to be obscene with your protein amount, but make sure you have a protein source or two in each meal. Dairy, beans, meat, fish, and bland is okay. Some of these foods, general healthy foods, are off-putting when we don't feel well. So ice cream has its place, milk, things like that.
What about
bacon? Bacon's a protein. It's like a lot of patients in the hospital, whether from cancer or a surgery, and you just need them to get the fuel, and we need you to eat, we need you to get your protein. So we're not going to be quite as restrictive all the time. If I've got a person who won't eat anything but bacon, well then, we're going to have to make that compromise.
So I don't want the listening audience to think I only eat bacon, chips, and fried chicken. Those are really good.
Well, that's true. I have to be careful how I put it, right?
Okay, so I took French cooking lessons one time, and I learned rapidly with my wife, and I learned that the key ingredients in French food were bacon, salt, and butter, and that almost every French food that's really good has bacon, salt, and butter or some permutation of that in there. And and it was really good. But I do try to be moderate with it. You know, I don't
Yeah.
have it every day, not every day.
I think that's the key. And if you look at the European population, they
They
walk
do okay.
a lot.
They walk
They're
a
not
lot.
as sedentary as we are.
But isn't
as
that
a
the real story,
population.
that really it's a story of good diet? And yeah, you're going to have discussions like bacon or
Sure.
chips.
Sure.
Try not to do as many chips. But a good diet coupled with exercise, right? And then trying to do things like that to stay healthy, because some of the
Right.
oldest populations or longest lived populations in the United States, you know, or in the world, have a combination of exercise and a
Right.
good diet, but frankly, a lot of fatty food too.
Yeah.
And some red wine. Okay.
Absolutely.
Interesting combination.
I know.
I don't really drink a lot of wine, so
Right.
I can do it in other areas.
And they socialize while they eat too. You know, they
Yeah.
take time to really sit down and have dinner with their families and friends, which slows you down. It slows that
So
intake
how many times are
down.
you supposed to chew each bite of food
Well, there, you know,
in general?
I think my first answer is chew it to a soft consistency so you're not swallowing food whole. But a lot of the recommendations say like 20, 30 times.
Yeah.
It's like
Yeah,
it's
you're
a lot
laughing.
of patience.
Can you do that? I try to do that. I'm like, I can't.
Yeah.
I'm like, oh my God, I think I chew 5 times and swallow, which is probably why I have a lot of heartburn and reflux. It doesn't have anything to do with COVID and stress. It's how I
Right.
eat.
Yeah, I think that's just kind of the culture we live in, right? We're
Yeah.
always on the go, we're grabbing and go, and we're eating when we don't even realize we're eating. We're in the car, we're walking,
Yeah.
shoving down lunch in 10 minutes, whatever
Right,
it is.
right.
And, it's the pace that
It is.
kind of
It's a little
becomes
crazy
the
right
Tootsie
now.
Pop,
So
isn't it?
Yeah.
that's what
Three for a Tootsie
choose for
Pop?
Tootsie Pop.
I love
Okay.
food, right? Just like
You can tell I love food.
I love
Yeah,
food,
that's
but I
great.
think if you pace yourself and you really
I start thinking about
can.
what my dinner's going to be like 3 days beforehand. So I'm like, okay, like right now I'm planning Sunday dinner. What am I going to cook Sunday
That's
night?
great,
My
too.
wife cooks a
Be
lot,
prepared.
well, no, I still love food, so okay.
Virginia wants to know vitamin C, vitamin D. Have there been any move on the needle that those help in the fight against COVID?
What do you think, Tara?
Well, I'm not specifically, the girls in the hospital, we have some COVID dietitians that work closely with those patients. We are definitely seeing that research that's coming out with the effects of vitamin D being promising. So in our recommendations, when I do cover those units, we definitely look at their vitamin D status and maybe recommend a supplement or infusion of some kind to get, because vitamin D is also linked to all these things I talked about today in helping, and there's a lot of link to inflammation. I mean, so many things with vitamin D that's coming out in research. So definitely something that's come across our table is promising evidence, and let's give it a try, because quite honestly, pre-COVID, we had a lot of vitamin D deficiencies too, and
We
it's
do. Well, even
important.
then, I think it's like everything else. If you're healthier when you go into disease, the
Yeah.
healthier you're going to be when you handle
Right.
that disease. And the less healthy you are, the harder it is. We already know that in
Yeah.
COVID, right? If you have many pre-existing conditions, your things go a lot worse than if you don't
Mm-hmm.
have pre-existing conditions. So
Yeah, I don't think as far as acute infection with taking in vitamin C and D, I don't think that's going to have an effect
It's
on
the
the disease course. But just as you said, it's the overall. And we know that vitamin D deficiency is so prevalent in the United
It really
States
is.
for one reason or another. But I think, certainly supplementing vitamin D, that's probably one of the biggest things that you can do for your health is make sure that your vitamin D levels are good. But
I know as a healthy white guy, very white guy, whose parents forgot to give him any melanin, or melatonin, I guess, I'd have to take my 2,000 units of vitamin D a day. Otherwise, my vitamin D level's terrible. And so I take my 2,000 units of vitamin D a day. And we do those things to help keep ourselves healthier when our diets are perhaps not what they should be, right? Because the reality is we ought to be eating enough and getting enough food sources. American diet and our lifestyle, as you pointed out, sometimes rush us through making good
Right.
choices around food.
Absolutely.
And as a result, we end up taking a lot of supplements, I think. So.
Yeah, and the sun is is the biggest factor in converting that vitamin D in
It
our
is.
body, and we're not getting out. There's this.
You got to go talk to the dermatologist, I see, because he's like,
Yeah.
stay out of the sun, wear a hat, wear gloves,
Right,
you're too
it's
wide.
tough,
Yeah, you don't
right?
need melatonin.
If that's
Yeah.
that's the biggest source of getting our vitamin D, it's kind of a challenge.
Yeah. All those
Get the cod,
Scandinavian,
the
Norwegian
salmon,
things. Ah, there you
the
go.
fatty
Picking it
fish,
up.
Yeah. Dairy, alternative dairy, it all stuff.
All right, Jill, next
So we
question.
have some off-topic questions that we want to address. Sarah wants to know, she wants to know if the doctors would comment on the recent change in the CDC guidelines for testing close asymptomatic contacts of positives.
Yeah, that just drives me a little crazy. And then it comes out that there's been a little pressure on the CDC
Yeah.
brought to do that, to decrease testing. So talk a little bit about that, Dana.
Yeah,
and then I'll
this
put
is
my 2
difficult.
cents.
I think there's, so Dr. Simpson, Steve Simpson and I, who's one of our great critical care pulmonary doctors, we're actually talking about this, and then 5 minutes later, yesterday, we saw that there was a breaking news report that there was actually pressure from the White House. I think it's a very backward way to think that if we stop testing, we won't have any more cases. I think the way moving forward is certainly to test more as much as possible, to really get, and we've talked about this for the last week or so, to get a very good picture of the actual prevalence within the community, within the United States. A lot of things from, the first case that was diagnosed in the United States till now have really centered around the capacity to test. So the capacity meaning, do we have the workforce to process all the samples? Do we have the materials to do the tests? Do we have the swabs? Because a lot of swabs were from, I think, Italy or China, but some of the other materials were from one of those 2 countries as well, so there was a backlog in swabs. Now we have saliva, so that helps. We have some saliva testing. But is there materials? Do people have access to get those tests? Are there enough places offering the tests because they have enough capacity to do the testing that they can do that and get a good turnaround time? We've said this before too. Getting a result back 3, 5, 7 days later really doesn't help. So we would certainly like to test everybody as often as possible and get a result back within 24 hours. Unfortunately, we have had just testing capacity issues. So the main thing with that issue also is that we have really said, because we knew we've had a lot of testing capacity issues, if you are a contact, you still need to quarantine, because even if you are asymptomatic and you go get a test and that's negative, that does not rule out that you still have to be in quarantine. So even with a negative test, you have to continue your quarantine if you're the contact of a known case. So a lot of the issues certainly is probably not the best way to go about it to decrease testing. We want more testing. We want more access to testing, whether that's at a health system, at another private lab or another private entity where you can get an accurate result. Unfortunately, we have seen a lot of changes frequently in testing guidelines, in treatment guidelines, in certain treatments that were not going to be approved and now are approved for one reason or another. It's probably not the best way to go, and we would certainly, the main strategy is going to be to have the general public access to test, access to accurate results in a timely manner. We just don't have that right now.
Yeah, I think that's the answer. And I think you just have to to borrow from Frozen 2, although I think it's not just Frozen 2 that says this, you have to do the next right thing. And when you look at the world and you say to yourself, okay, COVID is spread by contact, usually from breath and from our aerosols, what we breathe out.
Yep.
And if I'm next to somebody and I have a high contact and a high exposure rate, what should that person do? What's the right thing to do? Should that person who's been highly exposed go right out in the public and expose others? Of course not. So the answer to it is that person can either really go out and they can quarantine for 14 days, and if they're not symptomatic, then okay, fine, you didn't need to be tested. Or you can get a test and you can determine then how long I have to really stay quarantined or not, or if I'm a risk to somebody else. So I think that's the answer. If people say, well, we're not going to test those who are really close contacts, really high risk, we're not going to test you, but you have to now shelter in place for 14 days, okay, I'll accept that.
Yes.
That's fine. What I think is not fine is to say, well, we're not going to test you and you really don't have to be sheltered in place. And we're not even going to suggest to you that you have to be sheltered in place.
Yep.
So that's the dilemma. There's a bigger story here. And if you're going to argue that we don't have enough testing supplies to test the people who have the symptoms, then okay, fine, make that argument. But then everybody who's a close contact has to stay sheltered and has to stay quarantined for 14 days. And that way they will be sheltered while the risk of their spreading it to someone else unknowingly passes.
Yeah.
Or you can wait 5 to 7 days, get a test, and then go out.
Yeah.
And that's really the thing. And you can make the argument, but make the whole story. Don't just do the snippet. We're not going to have anybody test around if you've been if you're a high risk contact. Well, that's not the story. The story is that then you have to go quarantine in place for 14 days.
And this was a good point. We've brought it up, and it was brought up yesterday by a listener. A very great point. Well, if you're only testing people who have symptoms, your results are going to be skewed and your percent positivity, and we absolutely acknowledge that. Unfortunately, we don't have a mechanism in place to test everybody and go out and do that. Now, I gave the example, our partner on the other side of the state line, Truman, was very good. They were just going out and doing pop-up testing at one point. Any takers that were coming to where they were going in the community were able to go get tested. We don't have that all the time now. If we had better access for the general public at large, we would be able to do more tests, get more numbers, and then hopefully not only be testing the people who are symptomatic to raise the percent positivity, but it actually would hopefully decrease the percent of positive tests because of that.
Yeah, I think that is really critically important. And you're right, when people talk about testing, if we only tested those who are symptomatic, we would have a very high percentage of people being tested who are positive. And even when you do that, not everybody's positive. In fact, the vast majority are actually negative.
Yeah.
And so they've just got other colds, they got other illnesses, which are still very common. Or they're afraid and scared. And so, which is reasonable. So I think we have to be careful with how we talk about testing. Testing should not be a political tool. Testing needs to be what it is supposed to be. It's a tool for trying to take care of folks and for getting good health. It's a health care. It is a medical care tool. But unfortunately, it's become a bit of a political tool on both sides of the aisle. So I think what we have to do is return to its roots. And the roots are we do testing in order to take care of the public and to help protect people. And what we talked yesterday about how we've tested everybody on entry to KU.
Yeah.
And remember the reason we did that?
Mm-hmm.
The reason we did that was to figure out who was positive so we could help protect the rest of the campus and protect the Lawrence community, because really that's mass migration.
Mm-hmm.
Not many schools took on that. It is a huge logistical challenge. And I think KU should get a lot of credit for trying to do this. It's hard. But the reason you do it is, again, we know you've got a bunch of kids or a bunch of people come into one part of the community from another, then what happens is you don't know what they're bringing with them. Mm-hmm. And in an era of a pandemic, what you try to do is keep the rest of the community safe. And the way you do that is you test everybody who came in. That would be symptomatic or asymptomatic alike, because then you're trying to determine who are the positive people right out the bat who, if they were just going out to Walmart or going out to the grocery store, to the restaurants or bar or whatever, are going to make other people sick. And you don't want to do that, because if you bring in 20,000 people, the number of vectors we would expect it to be positive, 200, 400, 1,000, whatever you want to believe community prevalence actually is, what would happen is those become potentially super spreaders that go into the community. And that could be devastating to a town the size of Lawrence. So we said, look, let's test everybody when they come in. That's the next right thing to do. And as that information comes in, we'll try and let folks know about it as best we can. And I think that's the same thing. I mean, it's trying to think, how do you use testing to take care of people?
Yep.
Not testing to be a political weapon. Well, we need to take that off the table. Let's use testing to do what it was meant to do, to take care of people who are sick or who could have been exposed to a potentially very deadly virus that is not influenza.
Yeah. And I think, to contradict you just a little bit, as a political stance, I think one could take, instead of a chicken in every pot, would be accurate testing accessible for every household. I think would be more.
Yeah, well, and I don't think, I agree. You don't have to contradict me on that. I'm with you.
But as far as politicalization of the whole thing.
Yeah. I just
Instead
don't.
of promising a chicken for every pot, everybody, households get tested.
Yeah, I just don't like to see one party or the other party trying to bash the rest of the country about how they do or don't test.
Right.
So, comment for just a minute. Abbott got FDA approval yesterday on a 15-minute antigen test that claims 97% sensitivity and 98% specificity. What do you think of it?
Yeah.
Turn around 15 minutes, the size of a credit card in a wallet.
Is it a home test, a blood
No,
test?
it's a hospital-based test, or healthcare test. You could get it at a doctor's office, things like that. It's not when you do it at home. It's more like the rapid flu.
Yeah, I think that would be good if that was made accessible to the masses. There is the theory there that if the test is done correctly and it is a negative, well, then that means even if you have it, that you aren't at that point you don't have enough viral replication or viral load to be infectious.
Yep.
So if that can be done on a daily basis and it's cheap and it's accurate, I think that's a reasonable way to go. And if you could roll that out so it's accessible at different places, whether that's private labs, clinics, pharmacies, wherever, I think that would be that. I think that's a good step in the right direction.
Yeah, and I was trying to read about last night. It's an antigen test, interestingly enough, and 15-minute turnaround, 50 million doses in October, and $5 to $10 per test.
Yeah, I think
So that would be interesting to see how that plays out.
Hey, this is a follow-up to the discussion yesterday.
Yes, ma'am.
And the question is, colleges across the country report and share data differently. What does transparency around COVID-19 look like in an environment like a university campus? And how does KU compare?
Yeah. Well, the first thing is that KU does a great job, I think, and Dana can talk a lot about this as well, because they did test everybody, or offered a test. I think 95-97% of students are getting tested. That's I can't describe to you a remarkable feat that is. The logistics to have carried that off involved retired teachers, retired firemen, all sorts of community volunteers to help organize the testing. And again, to keep the college students, the campus safe, and to keep Lawrence safe. And people say, well, was that necessary? And I think it was the right thing to do. Part of it is, Lawrence and KU are an intertwined community. If you think of it as an ecosystem, and many of the businesses in Lawrence are reliant upon the college being open. So we're trying to keep it open. We're trying to keep people healthy. We're trying to make sure the disease doesn't spread wildly into the Lawrence community. So we committed to helping, at the request of the chancellor, to help KU organize and pull off getting every student and every faculty member and every staff member tested. So the first thing I would say is that is at the top percentile of the United States. Very few schools committed to that. Notre Dame committed to it. Alabama's committed to it. There are some others that have as well. I don't know every one of them, but I know most did not, and I think KU's the only Big 12 school, if I remember right, to do that. So the next question is, how often do you think, how transparent do you have to be with the data? So KU is still working on what their dashboard is going to look like, because you get all this data all at once. You then have to figure out how you report it all. So they're reporting it in tranches, and I think it's 1 to 2 times a week they're reporting it. I think they're trying to be really honest and clear with it. But the data's coming in pretty rapidly, and then, again, this is a higher education. They weren't necessarily constructed to report healthcare information on a regular basis. And there's a lot of work involved in reporting those tests and reporting them in a way that doesn't violate anybody's personal record or personal health information. So you can't report it down to such a level that, let's say, I want to know the first floor of X dormitory and how many people were positive. Well, you run the risk of exposing a person's personal health information when you do that. So you have to be very careful. I think the school's done a great job, and they will continue to do a great job of trying to report that information in a way that protects folks' personal health information, reports it in a very honest way. They're telling you exactly what the numbers are, and does it on a frequent enough basis, but not so frequent as they start running a risk of having data coming out that's not accurate. Because when you get the information to you, you want to double and triple check it to make sure that it's right. So let's take an example of a school that's reporting it daily. That's great, but they have a very few number of tests they're doing, right? KU has a whole bunch of tests they're doing, and so how they report that, and partly is based upon the volume of tests and information they have, and double checking it and triple checking it to make sure it's accurate before it goes out. And I think you'll find that's going to get better and better, and I think they already do a really good job of it. And I know they're trying to construct that dashboard so they can get it out there on a consistent way and report it on a consistent basis. But you think, oh, well, how come you didn't do that right from the start? Well, because this is a really complicated undertaking, and we focused on getting everybody tested to make folks safe. Now we're getting focused on how we make sure we get that information out.
Yeah, I don't have anything to add. You're exactly right. And we work every day. The numbers are updated. There always is some sort of lag in the numbers just because of the data resourcing and compiling, but it has been transparent. And I think to your point, there are a lot of community volunteers. I think in addition to the testing, there has been really good contact tracing of the known cases. They're a lot better than in a lot of communities around. So there are a lot of people working boots on the ground to keep everybody safe, to understand the contacts of the known cases, to help prevent the further spread of the disease in that community, not only on campus, but in the community as a whole.
Yeah, and I think, there are just so many questions that are surrounding a pandemic. We tell us that before we build the airplane while you fly it, and sometimes the parts fit and sometimes they don't fit so good, and then you have to repair it while you're out in the air. And I think that's true for colleges and universities around the country. Like, nobody's out there trying to do the wrong thing.
No.
We're trying to do the right thing and do our very best effort at doing the right thing. And I think we did it. I think we did it right. I think it's more important to have tested everybody and get back to those individual students to tell them that they're positive, and so they have to sequester in place and not go out. They have to quarantine in order not to make someone else sick. The reality is that the county health department, nor the university, nor the police department can actually enforce you from doing that on a broad scale. You're essentially leaving it up to the personal responsibility of the student. That's just the reality of the public health system in the United States. Love it or leave it, that's how it is. And so most people act really responsibly. When you say you have COVID, you got to stay at home, and most people do that. I think folks are worried about one or two folks who may not do it. Okay, that's true. But most people do. And it's far better off than not knowing, because remember, a lot of college students will be asymptomatic, and yet they can be spreaders. Mm-hmm. And so it's a lot better to know and say to that student, now you need a sequester in place. And so the focus of key has been on doing that, because that's what keeps people in the public safe. The testing reporting will catch up. It's much easier. If I do 1,000 tests and I already have to report on 30 of those, my life is super simple right there. When I'm doing 25 or 35,000 tests all at once in a very short period of time with a whole bunch of community folks, everybody trying to get organized to get all the testing in and get it done and get it reported, and then to continue to go back and look at a hotspot and try and drill down on it and talk to those kids about why they're a hotspot and how you have to deal with that and how you go back and retest, that's the focus, because that's what keeps people safe.
Well, and kind of a follow-up to that, in looking at different dashboards that colleges and universities have, pretty consistently they include the number of people tested. Mm-hmm. They break it down by faculty and students. Some link to all their county and state data and make it interactive. Some will include isolation and quarantine, and some don't. When looking at the data, what is the number or the areas at the percent positivity that parents should be looking at and students? What's the important information? Do you have an opinion on that?
Well, I do, but it's the same as we find in the public. So percent positivity is really important. But if you don't know what's in the denominator and the numerator, it's just hard to say. For example, if I am only testing people who are sick, then my percent positivity is going to be a lot higher than if I've tested everybody. So that set of data, if I only test somebody who's sick and I'm looking for the percent of positivity, is not comparable to what it is if I'm testing everyone, right? Because I'm testing a group of people who have selected themselves out to be tested. So the flip side is, if I only test a small group, let's say I'm only testing on-campus students and not students who are living off-campus in Greek or sorority houses or fraternity houses or off-campus housing, well, I'm testing a very select population of kids, because, is that population acting the same way as the population in the Greek system or in off-campus housing? Probably not. Would you expect the positivity rate to be different? Yeah. But if you don't know all that information, you don't know how to interpret the data. Again, I come back to, what is the goal of this? Is the goal to simply report information, or is it to keep your community safe? And the answer is, the goal of testing, and this gets back to what the CDC did, the goal of testing should be to keep the community safe and to keep people safe, and to keep families safe. That should be the goal of testing. So what's the best plan? To test select populations? No, the best plan is to test as many people as possible, especially when you open a college campus, and typically those are in smaller communities, you're bringing a mass migration, in this case 20,000 students, into a community of 80,000. Well, that's a huge change to that community, so let's keep the community safe. How do we do that? We're going to focus on testing everybody. I think that's the best thing to do. After that, then we'll try and get the data reported in a way that makes everybody can digest it and makes sense. But honestly, the data reporting is a little after the fact. The fact is, we've got to handle the spreaders, and the way you do that is you identify them. Thoughts, Dana?
Yeah, exactly. With the rates of asymptomatic spread, we need to identify who is infected, because we know that even people who are asymptomatic with no symptoms at all can certainly spread the disease.
And final question on this. Could you clarify, because sometimes you say KU, and I think you mean
Yeah, I
health
use
system.
that interchangeably.
So
I do that. I'm
people
guilty.
are wanting to know, yesterday when you said daily, what did you, who tests daily, and how often is KU releasing information? Or not testing, but how often are we releasing information? How often
Yeah,
is
the health
KU?
system releases it every day, but back when we first started, we didn't do that.
Right.
Because we didn't have it right, and so we didn't push out bad information. Again, you got to protect the people, you got to make sure you protect
We were
health
also
information
talking
and
over a
stuff.
phone, so.
Yeah, we were on the phone, and we were all huddled on the phone. We didn't have masks on. So there were a lot of things we did at the beginning that we over a period of months, we've kind of got it down. And now, in fact, we made a change 2 weeks ago where we reported both acute and convalescent patient numbers, right? So that was a change because we're like, oh gosh, we've got to report both because we want to be honest about that. So when I'm talking about daily reporting, I really am talking more of the health system. The KU reporting, I know, is at least once a week. I don't think, I'm not sure. I would have to go. You probably know better than I do. You're on the PHP calls. Aren't they trying to get the twice a week and maybe more frequent?
I think that at this point, yeah. And again, the data is coming in pretty quickly, and with testing overall, with cases overall, so they're trying to get it, but they want to make it sure that it's as accurate as possible when they do release it. So.
And the focus of KU, I'm telling you, it's really on keeping the kids
Yeah,
safe and keeping
I
the
do.
campus open, because that's what's going to do the best thing for the community.
Okay, so a couple of wrap-up questions.
Yes, ma'am.
Let's go back to food, because I have some people, they want to know, how important are spices?
Spices. Well,
Not garlic. I don't do well with garlic, Tara. Don't recommend garlic, okay?
funny you mentioned
Don't
that
give my wife
because
ammunition.
Whole foods are definitely going to benefit us greater. If you're talking like spices in like powder form and stuff, I mean, there's definitely some promising research in certain things. I mean, turmeric is a very common one. Garlic and onion is always going to be beneficial in promoting good health benefits. So yeah, I mean, and quite honestly, if we get to know our spices and maybe play with a little flavor, we might be able to reduce that added salt, which is a good goal to have. Not that we don't have a little room, but as we play with spices and flavorings of our foods, I think that's going to enhance us making vegetables more fun and things like that. So kind of getting in the kitchen and trying spices. So go spices, absolutely. But foods first, I think research is still kind of looking at the particular
And two quick
particulars and
follow-up for
spices.
you. One person wants to know how much time between eating and when I go to sleep. And then the other one is with the chamomile teas, can you drink it cold? Does it have the same effect?
First question, roughly 2 to 3 hours is kind of what we're showing.
That's what
is
we
that-
tell our patients, 2 to 3 hours.
Yeah,
Yeah.
2 to
And
3
if you make a fatty
hours.
meal, it ought to be 3 to 4. If you're going to have a lighter meal, 2 to 2
Right.
hours.
And high fat is linked to kind of a brain chemical that reduces sleep, quality. So,
Yeah.
avoid high fat. But 2 to 3 hours roughly. I think if you need a little snack before bed, make sure it's really small. Kind of stick to those maybe a few nuts or something. So yeah, just really avoiding that fullness of going to sleep and increasing digestive issues and heartburn and such that will affect sleep quality. As far as chamomile tea, I don't know any evidence or research on hot or cold, but the properties remain the same. So it has that antioxidant regardless of how we drink it as far as the temperature. And that antioxidant has that calming effect that we're wanting for sleep.
All right, last question.
Last question. Oh, I get one more? Oh, yeah, this is a great one. Is there any such thing as comfort food? Sydney wants to know because she's been eating a lot of it since COVID started.
There is comfort food.
Yeah.
I love it.
Yes, I'm glad that we're taking a little time to address that, and I know I've spoken to it a few, with our
Yeah.
conversation, but absolutely, I think it's natural to have comfort foods. It's not always about, we talk about emotional eating, but emotional eating can be happy and it can be sad, and I think we have to recognize that it has that place, and we get that instant gratification. I think in accepting that it doesn't have to be taboo helps us control it a little more. And yes, we're all eating a little more comfort foods lately, myself included, and I think,
Rock
again,
on.
that's perfectly
Rock on.
natural, right? Hey, I'm a real person, right? It all comes back to that balance. where can you find sort of make sure the weight is in such a way that the healthier foods are taking, the lead, and, allow yourself those moments, but then kind of move on, get back on track, focus, overall have that good, those foods, fruits and vegetables, there's great research on it linking to happiness. So put those in your diet a little more. But yes, comfort foods have their place.
All right. Well, thank you very much,
You're
Dana.
welcome.
Final thoughts from today?
Yeah, well, I'm Italian, so I love the garlic, so I'll take your
Oh,
garlic.
yeah.
Please do.
And I did see on Facebook that Oreos are nutritious and Sour Patch Kids are doubly nutritious because
Oh,
they're sweet
boy.
and sour.
I have to-
So
have to
I'll
research
use
that.
those this weekend. I'll eat those. If it's on
chocolate.
Facebook, it's got to be true,
Oh,
right?
well,
My wife believes chocolate is a food group.
So I think, leaving off today, we are heading into the weekend. I want everybody to understand that we had talked about this. There's probably not a first wave, a second wave. As we continue to move through this, we are going to see variations probably from day to day, whether that's because of data reporting, because of slow data results, or it's with the weekend or one thing or another. So people just have to understand there will be variations in the amount of cases every day. Hopefully, we want to overall bring that 10 or 14 or 7-day rolling average down as low as possible. But people just have to understand that there will be the variations, and the same thing in the hospital. We want as few people in the hospital as possible, but there will be variations in that as well. So we are going to continue, and we have continued to report as transparent as possible, honestly as possible. Again, the best sources of data that we are using are going to be the CDC and the local health department websites as well, but even some of that data is going to be delayed. So it will change a little bit, so everybody just understand that we are going to be reporting as honestly and as much as we know as possible from those types of sources.
I want to thank everybody for tuning in today. We got a pretty cool thing going on tomorrow. KDHE Secretary Lee Norman is here back with us, and we love having Lee on. It's always good to have a conversation with him. And he joins us. You may not have heard about this. We talked about it once before. Olathe West High School theater teacher Alicia Morris became an overnight sensation for tracking COVID-19 cases in our nation's schools and putting it out there for everybody to see. I've been to her website. It's pretty interesting. We'll look at her expanding website, and we're going to hear her story. We want to say thanks to everybody who responded to a call for blood this week at the Church of the Resurrection in Leawood. They had a goal of 650 units of blood, and they were off to a slow start. They ended up at 643. Well done. And just a big thank you from all of us in healthcare to the donors who are out there. And remember that we have it today and tomorrow here in the Health Education Building. You can also give blood. SaveALifeNow.org is where you can sign up. So, you know what? COVID-19 is hard. I want to say thanks to Tara Marchello for joining us this morning. She's done a great job, and it's been really helpful to have you on and let us try and guilt you into agreeing with Dan and I's diets, which we love. We want to thank all of you who are out there listening to our program. The difference between truth and fiction sometimes is really hard, and sometimes it's at different shades in our mind. I think around COVID-19, the best way to stay safe is to try and stay as close to the truth as you can. Because the further you get from there, you start thinking there's evil in every corner and there's evil in every message. Yeah, we try not to do that. We just try to tell you the truth, to keep you safe, and to remind you that the pillars of infection control, wearing a mask, keeping your distance, coughing into your elbow, washing your hands, staying home if you're sick. Those pillars, they go with you everywhere you go. So till tomorrow, just remember, there's still no place like home. Thank you.